Welcome to our Mary Greeley Primetime Alive presentation, Your Feet as They Age. I'm Vicki Newell, and I manage the volunteer program here at Mary Greeley Medical Center. As a reminder, if you'd like more information about Primetime Alive or how to sign up for a program, please go to mgmc.org/PTA. Our presenter today is Dr. Charles Galarski. Dr. Galarski received his Doctor of Podiatric Medicine degree from Illinois College of Podiatric Medicine and his bachelor's degree from St. Mary's College in Winona, Minnesota. He completed a podiatry residency at Windham Area Hospital in Windham, Minnesota. Dr. Galarski joined McFarland in 1989. And I also want to mention that he is the department chair for McFarland Clinic's podiatry department, and he is the clinical coordinator for Iowa Special Olympics Fit Feet venue. He's a marathon runner and has ran several of those, and he is a longtime Primetime Alive presenter. Please welcome Dr. Galarski.
Thank you, Vicki, and welcome. I'm standing in an auditorium with nobody here, but I hope that there's many people that are watching this. I hope that as I present that you have a piece of paper and a pen next to you so that you can, if you have a question or you can think of something that might stir your memory, write it down and hopefully we can answer it before the, or at the end of the presentation. So your feet as they age. So we'll get started. And there's aging structures. We're going to talk about the skin, soft tissues, bone structures, joints, biomechanics. We'll talk a little bit about nails. And you'll see on this talk there will be many models that I have that show you what a foot and ankle specialist sees when he or she looks at your foot. We look underneath the skin, we look at the structures that are there, and they are a roadmap to help us identify what could be the problem as you come into our office. And we're going to start with the largest organ in the body, which is your skin. And skin is very important. We have, it's the number one barrier to infection of the body, especially the foot and the structures of the foot. The skin is thinner on the top, and it encompasses the tops of the toes. As you could look in this model right here, you can see that the skin is very thin on the top of the lesser toes. And then as we get to the top of the foot, it's extremely thin. And we come to the bottom of the foot, and the outer layer of skin is called epidermis. And it's almost like if you can envision someone making pancakes and throwing pancakes on a pile. And that's what the epidermal cells are like. And the epidermal cells on the bottom of the foot are many, many times thicker than those on the top of the foot for shearing and for protection of the skin. So the skin has different functions in different areas of the foot. The skin actually helps us out because sometimes we will see that the skin has a reddened area or a hot spot. And sometimes the skin starts to tell us that there's something that's irritating, whether it be from a shoe or whether it be from an activity. And many times we'll see a hot spot right over here. And it could tell us that we could start to get a pressure to the skin where the skin might even break down or ulcerate. So it's important to take a look at your skin, and it's important for you to look at your skin on a regular basis, and we'll talk a little bit more about that later. When we break the skin, we have the potential for developing infection, and we'll talk a little bit about bacterial infections. Our feet walk on the floor, and if we walk in the house with shoes, we could bring in soil in our shoes, and if there's a break on the skin on the bottom of your foot, you can introduce bacteria, and these bacteria can start to cause a soft tissue infection. In patients specifically with diabetes, they can develop an ulceration over a prominent area, such as over here by the heel, or such as over here by the first metatarsal head, or possibly on the tips of the toes. And once the skin gets broken, then we can get this infection. And if you ever notice with your foot that you do have a hot spot, it's time to see a specialist or to see your primary care physician, because you don't want this to progress. When we have problems with patients and infections, many times it's because patients have waited for weeks before they come in for an examination. So as we age, we need to be a little more cognizant as to what is the best way to determine that, boy, we have a problem going on here, and we're gonna go in and have somebody take a look at it. And fungus infection is a condition that can occur with the skin. We'll talk a little bit more about toenails later, but fungus infection can affect toenails. When you have fungus on your skin, it can cause the skin to split. And then, of course, the skin has an opening, and then a secondary bacterial infection can come from the start of a fungus infection. So that's our skin structures. This is a picture of a clinical patient, and you'll see that they have prominence. They have an area here that's the skin covers it, but this is a bunion. And sometimes this is an area where the skin can get broken down. We also see some gentle bending of the toes. And this is possibly the early start of a hammer toe. And we can get skin problems here that can break down. So it's really important, if you have any prominence on your foot, that you're wearing shoes that have good fabric so you're not irritating these areas. And there's another interesting thing about the anatomy of this patient. And if you notice, there's a dark spot here, what can be referred to as a mole or a pigmented nevus. And it's important. We'll spend 1 minute here on melanomas. There's a increase in melanomas nationwide. And unfortunately, melanomas of the foot can be more serious than melanomas in other parts of the body because the foot can be neglected. And so if you do have any type of moles or similar lesions on your foot, it's important to show those to your physician. It's also important to notice that if they start to change, if they start to itch, if they appear to be getting larger, if they have two different colors, or if there's hair growth, that this is something that means there could be some active cell growth. And those could be an indication that soft tissue area needs to be biopsied, which can be done under local anesthetic in the office. So inspect your skin. Okay, this is a tough slide, but I think it's a good learning point. This is a gentleman who had a sore on the bottom of his foot right here, and he kept the sore for the better part of several weeks. And he chose not to go into the doctor, so he presented to the emergency room, and lo and behold, he had bacteria that entered this hole in his foot and has produced what's called a gas-producing infection. And you can see that the gas-producing infection goes up literally 6 to 8 to 10 inches above his ankle. And he has gas gangrene, which many of you may have heard in the past. And unfortunately, this toe had lost its blood flow, and this gentleman did have to go to surgery. The bone underneath this sore was infected and had to be removed as well. So the gentleman is doing fine. He has 4 toes, but he didn't have due diligence to come to the doctor when he had this for 1 to 2 to 3 or 4 days. Another interesting thing about this slide is this is a person who has a chronic fungus infection. If you look at the bottom of his feet, there's a reddened, scaly eruption along both feet in the distribution of what we call a moccasin distribution, chronic athlete's foot. And these types of fungus infections can be misrepresented as someone saying, I simply have dry skin. Well, this is not simply dry skin, and this would need to be treated with an antifungal cream or tablet or something. But anyway, if you see scaling like this, sometimes it's more than just eczema or dry skin. So it's time to go to a nicer slide. We've looked at that one enough. And I'm going to take a couple minutes here because it is important to talk about diabetes. For those of us that are aging, doctor might tell us that we have elevated sugars and we're pre-diabetic or we could be diabetic. And we want to be able to see palm trees and we want to be able to see beautiful things in our lives. And that means good health. And so it's very important that you inspect your feet. It's very important that you listen to your physician and you get your A1C checked, or you check your sugars, and you follow the dietary recommendations of your physician's office, because diabetes can create serious problems, as it did in that last patient. And we want to make sure that we stay as healthy as we can as long as we can. Okay, so we'll go back to feet. We're going to talk a little bit about soft tissue structures. The fatty layer, the fascia, the tendon, the muscle, the nerve, and the bursa. So this is the model for a normal foot. And let's take a look at that fatty layer. And you can see the yellow tissue that's surrounding the Achilles tendon, and the yellow tissue on the bottom of the foot underlying the heel, and all the way to the front of the foot. And then there's also a fatty layer on the top of the foot. Now, with age, we can lose some of this fatty layer. And it's most concerning when it's on the bottom of your foot at the heel. But more so, I think I see more problems when we have a lack of fatty tissue at the front of the foot. People can present to my office with hypersensitivity to their feet. They feel like they're walking on their bones. And it's because they don't have the padding that they had when they were younger. And that padding is pretty remarkable, to think that you could have fat underneath your heel after walking on it for 50 or 60 or 70 years. So Mother Nature did a good job at maintaining that fat layer. And sometimes we can take medications during our lives, like prednisone, that will diminish our fat layer. And so it's an important thing in the structure and keeping a healthy foot. And for that reason, when you are in your house, it's important that you walk with something on your foot to maintain cushioning underneath your foot with every step that you take. And if you're losing some of the fat structure on your foot, then it is a good idea that you have something. Now there's a shoe that I really don't recommend to people except for a house shoe. And it's one of these foam Croc shoes. And they're just made out of foam. And the nice thing about them is that every step you take, they compress down. Our houses now are made with tile and hardwood floors. And sometimes it could be very difficult on the bottom of our feet if we've lost some of the fatty layer or we have sensitive feet. So it's really important to have something on your foot, and preferably something that's not a flip-flop or something that's backless. I think you're better off to wear a sandal with a back strap, or this Croc device. So we'll talk a little bit about the fascia. Fascia is the connective tissue that holds down the tendons of your foot and the tendons and the muscle units. And fascia can stretch and it can age. And I'm going to go forward here. I want you to take a look at this current foot, and then we'll go over here and look at this foot. Okay? This is a foot that's probably had prolapse of the foot. You can see that it's a flattened arch. And that could be secondary to a defect in the fascia. It could also be secondary to diabetic neuropathy. But fascia and connective tissue structures do age. People can come in and say, as I've gotten older, my foot is kind of flattened out. And that can be aging of the fascia. Not too much you can do about that other than protection and wear something to assist your foot at carrying the weight and cushioning. Tendon and muscle, how do they age? I'm going to group those two together. Tendon and muscle do a great job. They provide us with good function. It's very important as we age that our muscle tendon unit remain flexible, that we can stretch and we can extend our ranges of motion. If we do activities and we want to start to get more active, we should first start out by going in a one-dimensional program, a walking program to go in one dimension. Don't start by kickboxing. Don't start by jumping jacks. If your tendons and muscles haven't done these activities in years, then you don't want to start by going to a motion that's herky-jerky, that's tough on the muscle tendon unit. Commonly in a given year, I'll see someone with a ruptured Achilles tendon. I'll see somebody with a ruptured tibialis anterior. I'll see somebody with a ruptured posterior tibial tendon. And on the other side, or the little toe side of the foot, we'll see a rupture with the peroneal tendons. So many times this is wear and tear, but sometimes it could be secondary to trying to do too much, too quick, too soon. I have a wonderful patient who was a newspaper editor in her life. And although she was a Pulitzer Prize nominee and she was excellent in her field, she didn't take care of herself. And so for the most part of her life, she was 75 to 80 pounds or more overweight. Well, she retired and she decided she was going to start to take care of her muscle tendon units. And so she started to exercise, but she did it with a personal trainer. A good personal trainer will tell you where you should go with your exercise and won't put you somewhere that you shouldn't be. Well, this patient has been doing this for over a year, and now she is doing some minor weightlifting, and she's doing plyometrics and twisting her torso, and she's lost 40 pounds. And she's a real success story. She was a success when she was in the business world, and she's a success now because she's taking care of herself. We'll talk a little bit about nerves. If you watch any TV show, you'll see that there are many ads out there for neuropathy. Do you have neuropathy? Neuropathy or sensory neuropathy frequently affects the foot. One of the reasons can be because of diabetes. However, sensory neuropathy affects the longest nerves in the body. So that's the ones that go to the tips of your toes and the tips of your fingers. The covering on the nerves sometimes becomes less efficient. And so the nerve conduction is not as good. And that can present with burning or tingling or numbness. And so nerves do age in time. And nerve problems can actually cause you to lose sleep. And so it's important that sleep is very important with aging. So if anything like that happens, then you need to investigate. A bursa, I talked to a human anatomist once, and she told me that she estimated that the body has over 500 bursas in it. A bursa is a small water balloon type sac that can be placed. Mother Nature there's a bursa under the heel, there's a bursa in front of the Achilles tendon, there's a bursa anytime these tendons make a different direction and they go underneath fascia. There's bursa structures underneath the metatarsal heads. And so bursas can age and they can move off to the side. And when they do move off to the side, of course, they don't function. And so that can start to create symptoms of problems when we have different anatomy as we age. Bone structures. So we'll talk about various parts of your bones. And this is, if you look closely at here and you see the metatarsals, the big metatarsal is 1, and then it's 2, 3, 4, and 5. And it doesn't take a foot specialist to see that there's a fracture here. And the fracture is on metatarsal number 5. And this fracture would require surgery, of course. But the interesting thing about bone fractures is that in spite of our age, our bones do mend themselves. And this continues our entire life. I have a patient right now who she's 93, and she recently broke the neck of her talus right here. Very serious fracture. But that being said, we treat the patients and give them the correct immobilization to allow that bone to heal itself. Bone structures are important. It's important to have good bone health, to maintain strength in your bones. That usually means good nutrition. And it also means the use of vitamin D3 and calcium. And you should discuss this when you see your primary care physician. As bones can get weakened, this happens to be a traumatic fracture, but which means it was an injury. But bones can break in spite of excess. One landing off of one curb with one foot is enough to cause a stress injury to a metatarsal. And so if you have point tenderness to one part of your foot and it stays there for days and it stays there for 7 to 10 days, it's a good idea to come in and have a specialist or your primary care doctor look at it so that you can determine whether or not you might have a stress fracture. Bone structures. This shows you the areas that we look at. We start to see stress injuries in the foot, in the heel quite a bit. We can get a stress fracture to the heel, and that can be secondary to jumping, not jumping, but landing from a high surface. And you can also get a stress fracture from excessive use, or you can get it from a one-time blow. We do see stress fractures to the metatarsals, as I've mentioned. With diabetes, we can get stress fractures to the middle part of our foot, and it's called a Charcot fracture. If these bone structures become weak over time, then if you have neuropathy secondary to your diabetes, you will push further down on your foot than you feel, and you can cause a bone to develop a stress fracture secondary to the excess pressure. What we have to be careful for in the bones of the toes is pressure to the tips of the toes. This is a high arched foot, and you can see that this foot develops claw toes, and we have to be careful on the tips of the toes because the bone can actually press the skin and create a sore. So inspect your foot, and if you can't see a part of your foot, get a mirror and see if you can look at your foot or parts of your foot with a mirror to see if you can see any changes. This is joint structures. Joints do wear out. They do get arthritis. This is a picture of an ankle that had an ankle replacement. And this is a procedure that's done at McFarland Clinic. Dr. David Kane does this procedure. And people who formerly were confined to their living room and walk to the kitchen and walk to the lazy boy now are able to walk around the block. And no different than total joint replacement with the knee and the hip and the shoulder. It is being performed in the ankle. Joint structures of the rear foot. This talks a little bit about joint structures, and this is why I have the flattened arch in this area, because the joint structures, they can wear out and they can also start to flatten. And this is what you would see. And something like this creates more plantar fasciitis, which the plantar fascia originates over here. And we also see that we can develop ulcerations or sores underneath prominent parts of the bone because normally these bones would not be touching the floor, and now they are. So, and that can happen through the rear foot, through the midfoot, and the forefoot and the toe. We'll get away from foot pictures once again. And I put this picture in here. I was golfing in Florida, and for those of you that golf, you know that in golf you can get a birdie or a bogey or a par, or you could even get an eagle. An eagle in golf is when you put the golf ball in the cup 2 strokes ahead of par. So on a par 5, you'd get it in there in 3. Well, I did get an eagle when I went golfing, and I happened to move up to the next tee box, and here I saw this eagle, and he was kind of guarding what he has in his talons. He had about a 14-inch fish, and he must have picked it up somewhere. And in fact, when he took off, I have pictures, he could hardly carry this thing. It was so heavy. But he was guarding it, and I mean, as you can tell, that is a tee box, and that was the one I had to use. So I thought that was kind of funny. I got an eagle, but it was not reflected in my score. And this is another one, and this is golfer unsuspects what's behind her, and she's playing the 9th hole at Homewood Golf Course in Ames, Iowa. And as she's teeing off, out of the woods comes this deer, and he's just watching, or she's just watching, and so it was just kind of a nice day on the golf course. Okay, let's talk a little bit about biomechanics. Biomechanics are important. The biomechanics of the human gait and walking on 2 legs and maintaining your balance. And it's important for us to have good biomechanics. And we have that when we have feet and ankles that aren't hurting us. It is very, very important to have good balance and to be able to uh, go in one direction and use our skeleton, and also so we prevent ourselves from having falls. A fall and an injury from a fall is very serious as we age. And so it's important if we have a painful knee or a painful foot or a painful heel, it's difficult for us to maintain our balance. And there's many exercises that you can do, even holding on to a counter and doing single leg balance on one leg and holding that for 10 seconds and then trying it with the other leg to maintain strength through your pelvis and maintain strength with balance. And so that's really important. If we want to start to become more fit, we want to start it with activities that are in one direction, as I said before. That would mean an exercise cycle, or that would mean simple walking, or it could also mean an elliptical machine if you go to a club. And once we get strong enough and we have good balance and we're getting accustomed to the one direction, then we might try a multi-directional activity. A multi-directional activity is something where your arms are crossing the midline of your body. This could be with plyometrics, or it could be with other twists and torques that you can do with bands that will get you a strength in more than just one plane. So it's really an important, and this all leads into getting strong enough to prevent from falling. So balance, maintaining increase in activity in one direction, multiple directions. These are all important when we age. So we'll talk a little bit about shoe basics. It's important. I would have to say that in my given week, I probably tell 3 people or 4 people that they have to throw their shoes out today. I look at the shoe is overly worn. When you look at the bottom of the shoe has elevated parts, and I call these elevated parts the islands. And if you wear out one island of the shoe, it probably means that you've worn out the part of your shoe that you need the most. And so continued use of that worn out shoe could cause you to twist the shoe, twist your ankle, fall down. So it really is important for all of us to inspect our shoes. As when I was running marathons, in fact, I still do it. When I buy a new shoe, an athletic shoe, I take the liner out and I put the date in the liner. And it's interesting to see when I start to develop a tendonitis or a problem, I'll go and look at that shoe and I'll take the liner out and I'll realize I've had that shoe for a whole year. And a shoe can get worn out, and so you need to change that. As we get older, another thing that we want to watch is when we look at the bottom of a shoe and we see all of these projections, we have to be careful, because if we buy shoes that are trail shoes, or we buy shoes that have large projections on the outside, as we go through the gait cycle, we can go through the swing phase of gait when we swing our leg to put our heel down, and we can catch one of these projections and they could cause us to fall. So it's important that you look at shoes that have a lower profile, so that if you do happen to catch your toe, you're not going to trip and fall. Okay, we'll talk a little bit about nail structures. Thick nails. Yes, it's natural as we age. Nails get thicker, and that's genetic, and you can thank your mom and dad. And even normal nails get thicker as we age. Our nails grow slower as we age, and when they get thicker, they actually will start to maintain a little different color too, so that they'll look different. We have to be careful with nails that are ingrown. A thick nail can cause an ingrown nail. It could curve in on the side, and you have to be wary of that. Anytime you take your toe and you could touch the sides or the tip or one part of the toenail and it's sore, that's not a good sign. It's possible that nail is causing irritation, which the highest level of bacteria in the foot is around the nail. And so if you develop a break in the skin around the nail, you have a potential to develop a bacterial infection, and you don't want that. What's very common now is discussion about fungus nails, We're fortunate to have good medicines that work for fungus nails. We have to be very careful with the use of those as we age. There are FDA-approved medicines by mouth. There's also FDA-approved medicines that are topical that work to eliminate fungus. And that's an important thing to keep an eye on, because we don't want to develop any type of problems with our toenails as we age, because right underneath that toenail is a bone. And if that bone gets pressure, and if the bone were to get infected, then that's a serious problem as we age. So we can get bacterial and fungal infections as we age. Discolored nails. Normally, the nail can turn just a little bit yellow or darker as we get older, but we have to be careful if we start to see black discoloration underneath our nails. Most of the time, it's harmless. Underneath your nails are a large plexus or group of blood vessels, capillaries. And if we drop something on our toe, or we have a thick nail that puts pressure, or if we have an ingrown nail, or if we have a shoe that presses hard, those capillaries can break. If the capillary breaks underneath your toenail, then you'll see some discoloration. Now, we have to understand that we can also develop a melanoma on our toe and a melanoma underneath our nail. And there are signs that the physician would see that would say this is a serious problem, or this is a suspicious problem, and this one is not. Most of the time when we do get some bleeding underneath our nail, as time goes by, the bleeding continues to grow out as the nail continues to grow out, and the problem goes away. And most of the time, discoloration under the nail is not a problem, so don't worry. But it's always a good idea to keep an eye on things and to see what changes in time. Some anti-aging pearls. Inspect your feet daily. It's an easy thing to do. Sometimes, if you're able to get your feet in your hands, it's a good idea to touch your foot. And sometimes, even if you can't see your foot and you press on a part, you might feel something that says, oh, goodness, this hurts a little bit, and I wonder why. I'm going to skip to the get a second opinion if you have a question. The second opinion doesn't have to be in the physician's office. It could be your spouse. It could be the person you live with. It could be your granddaughter or your grandson. And you could say, you know, would you take a look at this? I think it hurts here, and I think I might have a problem. Or you could have them look at your feet regularly and say, do you see anything there? And, you know, it would be you know, if you do this for your spouse, she'll do it for you, and you could help her out if she can't get down to her feet. But it isn't important that you get a second opinion in case you think that there's something that's going on. So once again, we'll talk about skin hydration. We want to have moist skin. Moist skin should be elastic, and skin hydration is important. It's really important on the top of your foot, the bottom of your foot, everywhere except you have enough moisture in between your toes. And it is a good idea to put hydrating cream on your skin. I like the creams that are on the top shelf. I like CeraVe. I like Eucerin. I like Amlactin. However, there are many, many good creams that you could use. Vaseline Intensive Care. And if you have questions, please ask your pharmacist. And your pharmacist will tell you, this is a product that's reasonably priced, and this is what I think works well. Anti-aging pearls, continue to stay as active as you can. If it's a rainy day and you can't go outside, then walk in your house. You know, if you're able to, go up and down the stairs a couple of times, but hold on to the banister, and stay as active as you can. That increases the blood flow to your feet, and simply standing in one place and walking in place also increases the blood flow to your feet. And if you were to walk in place and do this for 5 minutes, you'd actually realize that you would start to get out of breath, because it does require work to walk in place. Quality shoes are important. We couldn't be luckier to live in this day and age where we can go to a department store and get good shoes with a fabric top that'll protect all of our bumps on our toes for a reasonable price. Sketcher is a good, reasonable shoe. It has a lot of fabric top shoes, which is good. But we're fortunate in this community to have good shoe stores, and they will address your concerns if you go to them and tell them, I have a wider toe box. I need a wider toe box. I have a narrow heel. I have this. I have that. We have a lot of good stores here, and so get good quality shoes and change them regularly. And it's always a good idea, if you can, to be alternating 2 pairs of shoes. Don't wear the same pair of shoes day after day after day if you can't afford it. No smoking, primary or secondary. Fortunately, most of the people that I've known through prime time are healthy, and they don't smoke. I put secondary here because I know we can go to a casino and we can enjoy ourselves, but there can be smoking in a casino. And cigarette smoking will, you inhale smoke that can tie up your red corpuscle and make it a little bit difficult for oxygen delivery to your toes. And so try to avoid situations like that. So, getting close to the end here, and I'd be happy to entertain any of your questions. If not, any of you have ever been to this High Trestle Trail, right? It's a wonderful place to be on a nice, warm, sunny day. So that's about it in a nutshell. And thank you for listening. And if you have any questions, I'd be happy to give you an answer. Okay. How do you treat chilblains, red spots appearing on the foot or toes during cold weather? That's a real good question. And chilblains is a vasospastic disorder. It has to do with your blood vessels. And it's important for all of us to know that the regulation of the blood flow to our extremities is secondary to the presentation of the cold weather. If we go outside and we inhale cold air, if we go outside and it's 15 degrees and we don't have a hat on, if we go outside we don't have gloves, the body will tend to direct blood flow more to the center of the body and take it away from our fingers and our toes. And so it is important that once the weather starts to get below 32 degrees, or, you know, for many people even before then, that you bundle up not only your head, your neck, your hands. And I have so many people that come to me and they're wearing running shoes that are fabric, and it's 20 degrees outside. And I practiced across the hallway from an orthopedic surgeon, Dr. Bob Gitchell, for 10 years. And Bob would come to work with these big rubber galoshes, and he would park them right outside the exit door, and they were there for the whole winter. And you want to protect your feet and your ankles from cold weather. So good boots. Hopefully that answers your question.
Wonderful. Thank you, Dr. Galarski. You always have such great, useful, practical information. I appreciate your willingness to always give a program. If there happens to be any other questions that come through, he is still here. We'll have him pop over quick and answer those questions for us. But thank you, everyone, for joining us today. Our upcoming programs, next week, Wednesday, June 15th, we have a program on mastering disaster, how to be brilliantly and resiliently prepared. And as you know, in Iowa, we have lots of different opportunities throughout the year for disasters. And then in July, we have a couple programs. We have Tuesday, July 12th, again, 2 p.m., Women's Pelvic Health. And then the very next day, Wednesday, July 13th, we have a program on aging skin, keeping it healthy and wound-free. So thank you again. You do have a nice comment here. Wonderful lecture. Thank you. So no other questions as of now. Thank you, everyone, for joining us, and have a great day.